the electrical circuitry in a single cell is as complicated as the electrical grid of a big city. Just as a comparison. I found that pretty revealing. And that each cell has a program. I mean, like a mini computer. It's called the DNA. And that program is at multiple levels. That DNA, the program is in the nucleus, that has a certain property. It's in the cytoplasm, it has certain properties. It's in the membrane. It's like there's a computer in every part of that one cell. Not only is that cell complicated, but each one has its own, mini brain inside it. But the one that really was a bit of an eye-opener for me was a program on nova in physics, I think, and maybe a little astronomy. And what they said was, we are just merely atoms and molecules and electrons, which at the root level, that's what we are. And before I continue, I just want you to understand, here I am, as we said, a scientist. We have equations. We're taught to follow a system. But I told you there's an X factor. The X factor is that we then apply that to human beings, and there's no two humans that are alike. And as we are experienced practitioners, we keep on learning from our observations. So the observation made in 1 year shouldn't be the same after 10 years. You should have evolved because the observations are so much more. So now I'll continue about this NOVA program. We are just merely electrons and atoms, and we're moving in space and time in such a way that when they are overlapping in our eyes, when the light hits our retina, we see an image. But in the purest sense, we're not human beings. We're just people of matter and electrons moving around in space and time. Now, most people are going to go a little crazy and not know what that is. But as a scientist, that made a lot of sense because, as I told you, as I study the cell, the more I study, the more amazing I find it. It's almost like endless. You study it, and and this is over 10, 20 years, and new science comes. When you sort of open up and you find something new, then you find that from that new, more questions come up, and then you find the next new thing, which seems to answer it. Then you keep going deeper and deeper and deeper. It's almost like infinite, but I don't know that because that's not a scientific answer. However, it correlates nicely with the fact that what we observe may not be the reality. So the question really is, what is that reality? The reality is based on what we see. And what we don't see, apparently, can't be reality. And there's some analogy between that. So what we're trying to say is that what you don't see may be this extra spirit, this creator, but whether you do or not, let's talk about in a different angle. Is that I've lost my chain of thought a little bit. Is that these molecules and cells that they are moving in space and time, and really it's everything's at a molecular level. And what I was saying is that what you see is what you believe. What you don't see, you don't believe. Oh, this is what I was trying to say. In medicine, we have what's called evidence-based medicine. What means that you do a study. You put a group of people on a program, you use a placebo, it's called a double-blind placebo-controlled trial, and you come up with the result. That's called evidence-based medicine. I find it a little slow and laborious. But nevertheless, when I became a medical student, it just got going. It wasn't there in the 1950s, wasn't there in the 1960s, wasn't there in the 1970s. In the late 80s, and then when we were in the early 90s, evidence-based medicine became much more commonplace. To the point where people were really excited that we don't have to just guess now. We don't just have to talk to a group of people. We actually have studies that we can use to say that, after a heart attack, if we took an aspirin, fewer people had a second heart attack. That's amazing. By how much? 25%. Well, after a heart attack, when we took a beta blocker, there was another 25% reduction in a heart attack within a year. That's amazing. So we don't have to guess anymore. Then everybody should be on an aspirin and a beta blocker. I like that, right? And what we're saying here is that I lost my chain of thought here again, is that we are using evidence as gospel, because increasingly people say, you know, this drug was designed for X, Y, and Z, and you must do it. And what we found is that if the evidence shows something, that's great. If the tests, the experiments don't show something, it does not mean it does not exist. Does that make sense?
Yeah.
That's what I was trying to say. So let me see if I can say it again. The mere absence of a conclusive study does not mean it does not exist. So going back to humans is that if we don't see it, it doesn't exist. And I'm telling you, physicists have all proven to me that what you don't see does exist. And my job as a medical person is continue to learn about the body at the minutest possible level, but take a big look at the big world and try to make sense of it at the same time. And in my evolution, and I'll give you some examples, in my evolution, my thought process, as well as the scientific improvements, it leads me to believe that knowledge is endless. So there was an analogy, and I alluded to earlier on, I'm just going to repeat it, is that when I went to an IMAX at the University of Arizona, they tried to kind of look at the big picture, starting from man in prehistoric time to looking at the world from the atmosphere to the space, from the moon, the galaxy, the Milky Way. And all I could see was that it kept on expanding and expanding and expanding. And as far as your imagination could go, it's still expanding. And when we learn more and view more, it'll keep on expanding. It kind of mirrored what I am finding in my own quest, which is that the more I learn, and I'm not frustrated by it, I'm actually enthused by it, that this is an endless field, and I'm just excited to keep on learning, because in my kind of medicine, not only can I learn it, I can actually apply it. So here's an explanation. Most of my colleagues are practicing good standard of care in medicine, which dictates following certain protocols for hypertension, cholesterol, diabetes, etc., etc. However, because evidence-based medicine is slow, it means you need 5 years to figure this out, 10 years to figure that out. It's slow, and rightly so. I personally think you should find other avenues to accumulate knowledge. That 20 years later, it's actually 25 years, but some of the friends I've met locally here are about 20 years in practice. If they are still practicing pretty much the same type of medicine for those common conditions after 20 years, that doesn't sound like a lot of improvement. It doesn't exude confidence. And that's why I try to do the kind of medicine that I do, which is go beyond your medical field. Follow the standards, but go and learn science from other areas like physics and chemistry and neurology, biochemistry. There was just another science journal, I just forget the name of it. I think it was something related to biology. Nevertheless, when they are researching all these things, you can apply it to medicine. Not like with a drug placebo double-blind controlled study, but in a more functional way, without breaking the systematic approach that we were taught from medical school on.